Good evening, everyone. I'm Laurie Ledley, the founder and president of Valley Sleep Center, off camera tonight. I'd like to welcome Dr. Adam Frose. He's our behavioral sleep specialist at Valley Sleep Center. And we bring to you tonight a roadmap back to a good night's rest. Thanks, Dr.
Yes. Thank you, Laurie. So just a heads up for everyone. We had a couple technical difficulties right off the bat. So I have switched over to a different iPad than what we're used to. And in the past, I've been told that at times there may be a little bit of a lag. So just a heads up if I'm going through something that it may not be syncing up just right. So yes, we're going to be talking about the roadmap back to a good night's rest. So this is for people that have really been impacted by everything that's going on in terms of the last couple months, in terms of the pandemic, and they've just kind of fallen off the wagon. But honestly, this is for people that have been struggling with sleep for a lot longer than that as well. So hopefully these are some tips and tricks, so to speak, that can be helpful to get us back into rhythm with some good sleep. So just a heads up that obviously, because this is a webinar, anything that you discuss or ask questions about could be heard by others. So confidentiality cannot be obviously maintained, but definitely at the end of this presentation, I want to hear your thoughts. I want to hear any questions, comments that you have. So approximately 25-30 minutes is what this presentation is usually the length, but definitely feel free to ask questions after that. So without further ado, let me switch over to the presentation here. Okay. And here we go. Perfect. So the roadmap back to a good night's rest. So yes, again, I'm Dr. Frose, one of the behavioral sleep medicine specialists. I'm also a psychologist over here at Valley Sleep. So I always like going over a quick agenda. We want to look at why we're changing, the root of change, understanding your own pattern, some specific things that will be helpful to integrate into your sleep patterns. We want to look at this as not just a weak change, but ultimately we want this to be a long-term change. We want to look at backup plans and taking things one day at a time. So, building your why. Why do you need to change? This is one of the things that I like to talk about first, because you need to drive, you need to have some kind of impetus towards change, right? We want to be able to understand and know what things are like right now and build up enough evidence for yourself, build up enough oomph, so to speak, to realize that you want to make some changes. And they may not always be easy changes, right? I wouldn't have a job if this was an easy transition. Insomnia is a very difficult thing for many people, depending on how we rate insomnia, the different diagnostic criteria. Somewhere between 6 to 30% of people struggle with insomnia, so definitely not alone. But back to building your why, think about why you need to change. Specifically, what will life look like if you keep things the same? So if we always do what we've always done, we will always get what we've always got. I love that saying. And this is the thing, when we're thinking about sleep, among other things, but specifically about sleep, if you continue to do the same things, most likely sleep's not going to change. It's going to stay the same. And another question, what positives would come if you were to change? Perhaps a more optimistic thought here, right? So again, if we want change, we want to alter, alter our patterns to get a different result. What is often helpful in those that I work with is when they come in and they have this notion of, I am making sleep a priority. I am making it a must. Sometimes when we put sleep on the back burner due to job constraints, due to family concern, due to other things going on, obviously there are important things that are going on in everyone's lives, but when we put sleep health on the back burner, usually it kind of suffers, right? If everything else is in front of it, then we don't really change, or bad sleep patterns kind of come into play. So we need to make this a must to get it to a point where we really, really realize, all right, I got to work through some things. I got to plan out schedules. I got to, you name it. So we're going to be talking about a few of those. And the way I like to look at this is that, sleep health is clearly only one part of your overall health picture. And yet, one of the wonderful things about my job is that I get to work with people, and oftentimes when they're able to switch things over, it's like this one match that ignites, right? And what happens is that other areas of people's lives often expand and get better because we have more energy, we have more clarity, our mind is clear, we have less stress, less anxiety, that kind of stuff. So I want you to think about this as, okay, this is one of those things. If I address, potentially, other areas of my life can improve. So the root of all change, when we're thinking about sleep patterns, right? Why is it difficult to change from bad sleep patterns to good sleep patterns? Ultimately, when we're making changes, this statement, how willing we are to be uncomfortable, often is at the root of change. This is a similar kind of thing to diets as well. Changing up, I guess, anything that it comes down to when we are trying to alter something, usually there's that one thing that we're not willing to do, right? There's one point of, I'm willing to do X, Y, and Z, but I'm not willing to do blank. And you all know what that is, and to be honest, sometimes, when it comes to sleep, there's a little bit of, well, hey, I don't know what the heck to do, so that could be part of this as well. But when we know of something to do, something to try out and change, and we can't get there, it's because we're just not willing to push past uncomfortability of some form, and obviously that's somewhat of a blanket statement, but in many, many cases it's true. So another thing that often keeps us in the same place is the payoff of sticking with our current schedule or our current patterns. This can be very different for different people. One could be, the classic case of staying up because we're on our phone or we're watching TV or something else, right? So the payoff is that we get to distract our mind, we get to do something else, and we get to have maybe some alone time, like self-care time, playing a game on our phone. That's the payoff, and we're not willing to change that up. Or for someone else, it may be, they're planning things out, whether that's stress at work or stress family life or something else. That's what's going on, and that's what they're trying to figure out. So the payoff, if they change up their sleep patterns and they're more calm and relaxed, is that they'd feel like they're not as ready for the next day's challenges. So there's usually something in the way here. So the key is to understand your pattern, right? Everyone is different. Every single person I have ever worked with has somewhat of a different clinical picture, right? We're multifaceted beings. We've got different things going on. So at the moment, though, I want you to think about, what is my pattern? When I go to sleep, What am I doing? What am I thinking about? Am I relaxed or is my mind racing? You know, am I calm or am I planning things out the next day? So specifically, what you're doing before bed. Watching TV, on the phone? Are we looking at clocks at the beginning of the night, in the middle of the night? Are you asking yourself, are you saying to yourself, all right, I need to get more sleep, or, you know, I'm going to be a zombie tomorrow, right? These are the kinds of things that we want to be aware of.
Sorry to interrupt you. Would you mind going backwards 2 slides? We got the lovely green screen.
Okay. Thank you for letting me know.
You're back. You are back, but maybe just like, I think 2 slides is all they missed. And I promised everybody your words are more powerful than your images anyway. So,
okay. So
just in the video for you guys too.
I am curious. So when it goes to the dreaded green screen of terror, does it mute me as well?
No, we can hear you. We can hear you.
Okay. Oh, okay. Okay. Yeah. Wonderful. Yes.
Yeah, we can hear you just fine.
Okay.
And I think just carry on, just so everybody knows, I have a recording that I can send you guys all via email when this is over, so you'll have it to listen to again. Okay?
Yes. Yes.
Thank you. All right. Thank you for that.
Yeah, sure. And yes, how technology giveth and taketh away here. But yes, the root of all change, how willing you are to be uncomfortable, you know, asking yourself, what's the payoff? You know, some simple but pretty profound sayings here. So understanding your pattern and, you know, staying up doing things, you know, specifically getting back to things that you can think about of your pattern, sleeping in, changing schedules, all that kind of stuff. That's important for your pattern. So switching slides here. Also, your sleep schedule may change depending on situations. You know, it could be work related, could be family, significant other related. What we want to do with all of this is get out ahead of patterns that are not working for us. And honestly, I know it can be difficult to figure out, okay, what is my pattern and what's the result, right? A lot of times it's not that analytical or clinical, you know, we can't put life into boxes, but sometimes it can help to, you know, look at what the norm is. So ultimately, you know, asking yourself, where does sleep fit in? So again, some other things in the middle of the night, if waking up to use the restroom once is going on, I'd say, hey, no worries, that's pretty normal. And yet we want to look at how long it takes you to fall asleep, because what wakes us up is not what always keeps us up. And, you know, if it's waking up 5 times to use the restroom in the middle of the night, that may be something different as well. Is a significant other waking you up? You know, I can't tell you how many times, you know, people will kind of delicately be like, you know, my husband, my wife, my girlfriend, my, you know, whoever, they snore or they move around, or my pets, or, you know, this is something that obviously is going to impact sleep, you know. And so when you're awake, do you just stay in bed? Looking at your mindset is another important part of the pattern. Like I alluded to a little bit beforehand, what's your mind like at night? Do you have a wind down pattern? Something that you can do to help you lull into the evening hours. You know, do you go to sleep relaxed? So all things to think about in terms of the pattern. So instead of just looking at the things that you want to change, let's look at now some helpful sleep behaviors. These are the things that you want to utilize to anchor your sleep a bit. Regularity, going to bed and waking at the same times. We've got a lot of different things going on, you know, temperature changes throughout the day, hormone changes, circadian rhythm changes, right? All of this stuff, our body for the most part is on a 24-hour clock. So it kind of makes sense. We would want to line up sleep. If we sleep over here sometimes, over there sometime, if we change up by an hour or two every night or so, our body doesn't get as quality of sleep. So we want to sync that up. The wind down pattern that I just spoke about a slide or two ago, it can be reading. Reading is the standby. And I will say, if you're one of those people that you read a good book and then 7 hours later you're finishing it, that might not be a good wind down pattern for you, right? For most people, reading can help lull them, help them feel relaxed, but everyone's different. If reading is not your thing, yoga, practicing stretching, something simple, something that does not involve TV, lights, electronics, phone, all of that kind of stuff. Looking at naps, naps are sleep stealers. So sometimes we can still go to sleep, just as easily if we're napping during the day. But ultimately, we're stealing sleep from somewhere, and that is actually kind of training us to not sleep as well during the night and then have more so of like this biphasic pattern during the day, right? So we really want to get to a place where we're only sleeping in one chunk if possible. No heavy meals and no alcohol around 3 hours before bed. Different foods can impact us after we digest them. Alcohol can have what's called a rebound effect, where it's a depressant, and then once it's metabolized, it somewhat acts as a stimulant. So definitely things that can impact sleep. We all know about caffeine. So early in the day, early breakfast, that's okay. When we're starting to get into the early afternoon hours, I would say nix that out as best as you can. The bedroom is for 3 S's: sleep, sex, being sick. That's it. We want to have as minimal amount of time in the bedroom as possible. So we don't want to read in there. We don't want to necessarily chat with other people in there, significant others, kids. We want to, again, this is an association is built with the bedroom, and if we can minimize the time awake, that's conducive for sleep in the long run. So if you are one of those people that has difficulty falling asleep, staying asleep, so you're waking up in the middle of the night and you can't fall back asleep, or you're just waking too early, if you're staying in bed, then to a certain degree, it's training yourself to be awake in bed. So this is one of those things where you want to actually get up out of bed, go into a separate space, outside of the bedroom, doing something relaxing, no electronics, no TV, any of that stuff. And then once you're tired, to be able to go back into bed. The clock, it's a bunch of simple numbers, right, for the most part. I guess this Apple Watch, hopefully the screen has transitioned over. I mean, clocks, watches, all that. There's new fandangled apps, all this crazy stuff that we can do. But just in general, the thing is, if we are aware of the time in the middle of the night, usually, not always, but usually it is somewhat stimulating to our brain, right? We're thinking of, okay, I slept 4 hours. I've got 3 hours left until I got to wake up, right? And then it's, oh my gosh, I have 2 hours left. Now it's an hour and a half, whatever. We want to be in a place where you're internally referenced. You wake up in the middle of the night and you say, how am I doing, right? Not based on a clock and based on time, any of that. Obviously, alarms are beneficial, but not to be checking that sucker all night long. Relaxing is also an obvious and yet not as often participated in activity. So clearly, we want to be relaxed when we are going to sleep. It is helpful. It is a good idea to be calm. And so if you're one of those people that finds it very difficult to relax, it's not as simple as it sounds, Dr. Frose. I know, I hear you in my mind, I know. But there are ways to be able to work through this, right? So figuring out whether it's breathing techniques, whether it's progressive muscle relaxation, whether it is yoga nidra with our wonderful Lori, who's on the call. She does that with people to help train them in a different way to relax. Whether it's mindfulness practices, all of that kind of stuff, right? So we want to be in a place where we're relaxed. And autopilot, this is something I really, really enjoy talking about because it is so prevalent. Everyone is on autopilot. What I mean by autopilot is this, we're in the motions, so to speak. We're used to doing things in a certain way. So you can think of this as driving a car. The first time you drive a car, really difficult. As you get used to it, you become somewhat, on autopilot. You can talk on the phone and drive at the same time, and it's no biggie. Whereas the first time, oh my gosh, it's really difficult to do that, right? You're checking all your mirrors, you're driving, all that craziness. So we form autopilots with a lot of things in life. So specifically with sleep, how we're thinking about the next day. Are you planning out what's going to happen the next day? Are you trying to figure it out? Are you thinking about the current day? What happened? How did I do? What were the issues? What were the stressors? What do I have to, This can be an autopilot. And simply it's a habit, it's a pattern that we get into, and it's no different for sleep practices or sleep autopilot, so to speak. Sometimes our mind is more awake and racing because, we are ultimately telling ourselves, I have to get ready for the next day, or I have to do X, Y, and Z, or it's not going to work out as well. And I would say, ask yourself, is that actually true, right? Is this the time that I should be doing those kinds of things? So there's a lot of different types of autopilots, but something to think about if you can kind of think of any of the quote-unquote autopilots that you've been on. Especially with planning things out for the next day, writing it out earlier can be helpful, so that way you've got something set out. You can tell yourself, hey, I've already done this, right? There's no need to think about this. I've got it in the other room. And realizing, you're going to get it done tomorrow. 99.9% of the time at 10 p.m. or 2 a.m. or whenever it is that you're going to sleep normally, nothing is going to be different than when you wake up at 8 a.m. or 10 a.m., right? Worrying is not going to change it. So one of the other things, seeing the time at night as a benefit is really helpful because you want to change around this time. So a lot of people get frustrated with going to sleep because it's one of those things where I'm so darn tired. What the heck is going on? Why can't I sleep? It's the only thing I want to do, right? And so it can become this thing where our stress about sleep actually negatively impacts sleep. This may sound bizarre, but the time to yourself at night, you want to think of it as a good thing. So when you have that time, you're in bed, you're going to sleep, one of those things where you can tell yourself, all right, this is a time to be mindful. This is a time to practice mindfulness, practice meditation, practice breathing. If you're going to be in bed anyway, might as well do something that is somewhat calming and relaxing, something that has been shown to be helpful for your mental health, So again, it's a little bit of a shift, but seeing the time at night to a certain degree as a benefit can actually, be very helpful in the long run. And looking at morning patterns, you want to look at, am I getting light in the morning? Our circadian rhythms are often based on light exposure to a certain degree, and so we want to get a lot of light early in the morning, and it hopefully will kind of taper down as the evening goes. So this presentation is, looking at a lot of specific things to change, but the whole goal here is not to look at changing sleep for a week. We want to look at, okay, how do I restructure my sleep for the long game, right? The game meaning life. So these are specific things, but we really want long-term lifestyle modifications. So this isn't to say that during my talk so far, when I've been talking about stressors or things that come up in the middle of the night, and everyone has different things on their mind right now, but this is one of those things that sleep does not have to be the most important thing in your life, and everything else doesn't matter. You know, I definitely don't want that to be coming across. It clearly is a very important part of life, but we want to be able to figure out a pattern that makes a good sleep pattern, good sleep habits, wind down patterns, all of that kind of stuff as part of the norm that works with all of these other things, all of these duties, tasks, other things going on. You know, so short-term changes in general can be most difficult, you know, honestly, because when we are in motion, we stay in motion. When we are not in motion, it's difficult to rev up the engines. So depending on who you are and what is going on, you may be both trains. You know, in different areas of life, certainly we are all both trains. What I mean by that is that, you know, this train on the left that is standing still, and this train on the right that is going 1,000,000 miles an hour, it seems. In some capacities, we are stuck. You know, that's kind of how I'm picturing this train on the left. It's not moving, it is stuck. That can be with sleep, that can be with other areas of life, but on the right-hand side, it's going 1,000,000 miles an hour. We've got the habits, we've got the pattern down, and the thing is, you know, just like this train going, I don't know, let's just guess 100 miles per hour. What happens when you're going 100 miles per hour is it's pretty easy to continue going in motion because you've got momentum, you know, you've got things built up. This train on the left, it's harder for that to go from 0 to 5 miles per hour than it is for the other train to go to 100 to just stay at 100, right? So that's the analogy here. It is difficult to get revved up at the beginning, but once you're going, once you get the patterns in place, it's a bit easier. So right now, you know, hey, not doing anything else anyway, I want you to think about what this could be like if you get better sleep. You know, the clearer the picture in your mind, the better. So what would that look like in the morning? How would you feel? Would you change anything throughout the day? Would you have more energy? Would you try different things? Would you be maybe less grumpy? Let's be honest. Lack of sleep often impacts irritability. So again, the thing is, you want to build up the importance of changing this because again, it is, you know, it's not always such a simple fix. So I've been talking about a lot of changes, but let's be realistic. It is good to identify backup plans. So for example, no one on earth, at least that I know of, was aware this pandemic was going to happen. It has shifted our plans quite a bit, right? What we want to do is think ahead, you know? So when curveballs happen, so everyone has different things, whether it's family duties, work duties, other things going on, medical concerns, whatever it is, those kinds of things, it's life, they happen, right? So we want to be thinking about what we can do in advance so that we're not as thrown off. So getting back on the horse specifically means that you will fall off on the horse, right? I mean, as a clinician who works with people, and I talk about this all the time, I don't have perfect sleep. To be honest, I have a lot better sleep than I used to. It's not perfect, but why it is a good pattern overall is because I know if there is something going on, if I am out and about and I am past the bedtime, you know, I want to get back on the horse. I want to get back onto my norm, the guidelines, the set times that I go to sleep and I wake up, all that kind of stuff. So this isn't to say that you can only follow these guidelines, day in and day out. And if you ever stray, it's going to fall apart. No, usually it's about realizing, all right, if 90% of the time I'm doing something and it's a good, they're good guidelines, good practices, and if I ever fall off the horse, then I get back on the horse, then you're going to stick with a pretty good sleep pattern. Oh, and I will say, I was working with an individual, and she put in this fail-safe of, okay, thinking ahead if something happens, if I don't want to get up at a certain time, because that was one of the most difficult things. The fail-safe was, all right, I'm going to make a promise to myself that if I don't get up at this certain time, that I have to pick up all of the cat litter in the entire home every day, which sounds kind of, who wants to do that? For her, it was the worst thing in the world, right? And so that helped her to get up in the morning, because she knew if she didn't, then she had to do that. So again, kind of putting some rewards and or punishments, honestly. Picking up cat litter is kind of a punishment on yourself. To have this workout can be helpful. So taking this one day at a time is also important. Again, don't think about this for the next 15,000 days. I've got to follow these guidelines. No. You have to be present, make decisions one day at a time. You got to follow guidelines one day at a time. It's 24 hours. I mean, you're only awake and alert in the present anyway, but it's important not to psych yourself out and realize that, small steps lead to bigger steps for sleep. Very rarely when I work with people, I work with them 1 week and then the next week they're completely, everything's wonderful. No, it takes time, right? You've been training your body, you've been training your mind to, not sleep as well to a certain degree. Things are going on which impact sleep. So oftentimes it's this thing where we're working on one thing, we can work through it. Great. Okay, what's the next step? All right, and we're improving the whole way as we work through things. So it's important to focus on the successes through the path as well. So I work with people obviously here at Valley Sleep Center on sleep difficulties. So I hope everyone enjoyed this talk. If there are those of you that would like to discuss things, further, definitely let me know. There's a pretty easy way to get set up with me on the website, valleysleepcenter.com. You can schedule an appointment, just kind of see the click on button there. I will say if you are someone who has not worked with any of our physician providers, so you haven't talked with any of them, we want to get that sorted out first just to make sure there isn't something from a physical stance that's going on. So for example, like sleep apnea or something else. But if you've already kind of worked that out or still having sleep difficulties and all of that, then you can go into the schedule an appointment and directly schedule with me. So on the left, you can schedule online, or you can just fill in some info and someone will give you a ring and put you in my clinic.